Thank you very much for being here today. I'm going to start with the latest COVID-19 numbers here in the Commonwealth of Massachusetts, but also the city of Boston. In Massachusetts, as of yesterday, Wednesday, the state reached a goal of 107,611 cases, excuse me, a total of 107,611 cases. It was a one-day increase of 172, and the state now has confirmed 7,938 people have lost their life due to COVID-19, and that's up from 48 from the previous day. Boston numbers are as of today. That's why I was a couple minutes late coming down. We just got them. We had a one-day increase of 29 cases. We have now recorded 13,382 cases, and if you've noticed, our trend has been pretty low in the city of Boston over the last couple of weeks. We have confirmed that 9,303 people have fully recovered from COVID-19, and that's up by 47. So I want to just thank or congratulate all the people that have recovered from COVID-19. 703 people, we have lost 703 people due to COVID-19 in the city of Boston. That's up from 3 deaths recorded the day before. And as the people that are still sick and suffering with COVID and the families that lost loved ones, we want you to know that we're thinking of you and praying for you, and we have been, quite honestly, from the very beginning of this pandemic. Our public health metrics continue to move in the right direction. Average new cases in Boston came down by 50% from the time frame June 4th to June 17th and continue to decline, which is a great sign to see. The overall positive test rate is down to 17.9%, and the last week's rate was 1.9%, which are both new lows that we're experiencing here in the city of Boston. And the number of COVID patients in Boston ICUs is down by 87% since the peak in April. So we feel good about where we are as we enter into phase 2, step 2 in the reopening. We're here because residents and businesses have done an incredible job of doing what we asked people to do over the last 4 months, wearing face coverings, washing hands, social distancing, physical distancing, doing all of those things, and those measures clearly are working here. And as a city, I'm certainly proud, and I want to say we all should be proud of where we are in the city. And if we want to keep this momentum moving forward and keep going in the trend that we're going, we need to continue to be very diligent in our work. That's quite the contrast to what we're seeing in the United States. We saw the most new cases of any day since this pandemic started yesterday, with 36,000 new cases here in the United States of America. Several states are in full-blown surges. These are very concerning, and it's a stark reminder of how quickly this virus can spread. And as we see the map, if you look to the northeast part of the country, where we were hit pretty hard 2 months ago, we're seeing us in a lot better situation, and a lot of the residents of our cities and states across the northeast region continue to be very supportive in doing what we need to do. So far, every new step we've taken in reopening, we have a renewed focus on the risk involved and the precautions that we need to take. One is making sure that we don't spread the virus. No business should reopen unless they're ready to do so safely. By meeting all of the state requirements, by working with the city and some of the requirements that we have, and by managing the risks every single day. This is not something that we can feel comfortable with in a couple of weeks or let our guard down. We need to be continued to be very cognizant of the fact of the virus. I'm inviting everyone to consult or work with the guidelines and resources that we have available. If anyone has any questions at all, we're asking you to go to boston.gov/reopening. We've been very open and transparent since the beginning of COVID-19. We've got as much information out to people as possible. I think in some cases we might have overloaded people with information, but it really is important that if you have any questions, you go to boston.gov/reopening. Small businesses can apply for PPE, for grants to buy PPE, cleaning products, petitions, and other safety resources. Many of the concerns we heard in the very beginning was our small businesses that they wanted to open, but they didn't have the ability, they didn't have the financial means to be able to buy the PPE or the cleaning materials or the petitions that are needed in stores. So we created that fund, and we're asking you to please apply for that fund. This week we've been hosting information sessions for businesses in many different sectors. The recordings will be posted online, so people that couldn't make it to the session, they'll have an opportunity to understand and hear some of the questions that might have been asked, but the information that we have. And we have more sessions for each step as we move forward. And for everyone, we're asking you, when you patronize businesses, whether you're outside your home, we're asking you, please wear a face covering. Stay 6 feet away from others, avoid crowds. I notice a lot more people wearing face masks, and as they're walking down the street, they're pushing to the left or to the right so that you're not walking close to each other crossing down the street. We're asking people to continue to wash your hands as often as possible with soap and warm water, making sure that that's something that you have to do. A lot of people now are fist pumping instead of handshaking. You can still contract the virus through fist pumping. So we're asking you to make sure you're constantly washing your hands and doing all the things that you need to do. We're asking you to clean down surfaces, the doorknobs and knobs and different things like that in your home. As people come up to the door, you might have delivery drivers not realizing and touching the door, touching the doorbell. Again, all of these are precautions that people have been doing that are working, and the proof is there. All you have to do is just Google online, look at United States of America, look up coronavirus cases. You'll see the left side of this country and the southern part of this country where it's all dark red, and you'll see on the right side of the country where, I think, depending on the color, depending on what you watch, sometimes it's a soft yellow, that show that the cases are really low. Those are things that we have to continue to be very cognizant of. Do your part in keeping yourself safe and your community safe, and help keep Boston and Massachusetts on track in this recovery. It would be a shame to see all of this incredible work go to the wayside and see these large surges that other places are seeing. I'm not saying that we won't see a surge in September, because certainly that's something that all the experts are telling us, but it depends on what that surge will look like. Recovery means, first and foremost, containing the spread of the virus. That's how we'll restore our economy and our community in a way that's safe and sustainable. And to achieve both of these goals in every aspect of recovery, it also means equity. We have the resources and the opportunities to we're putting the resources and opportunities to where they're needed. And we have to rebuild our systems as we reopen, to eliminate the strain of racism, to create greater opportunities for those who have been excluded in the past. That's how we're going to emerge out of this crisis stronger as a city, and honestly as a community and as individuals. That's how we're going to respond with resilience to any challenges that we face. Today, my announcements today advance our work to root out systemic racism and build up racial equity in our city. As I said at this podium almost a month ago now, I talked about I'm going to listen. And I talked about there will be a time for plans, and there'll be a time for action, there'll be a time for investments. And that's today is another day in advancing the work that we need to do in the city. The conversation that every community needs to we need to keep at the forefront. And it's a conversation that needs to produce both immediate and ongoing change. That's what we're committed to here in the city of Boston. And that's why we're taking some important first steps in the very last few weeks here. We introduced immediate reforms, working with the police department and policies including the 8 can't wait, use of force standards, and new intervention training that the police department is working on right now. We created a task force to conduct a deeper review of police policies and oversight. We're going to bring that review to the community and act on the recommendations this year. They had their first meeting last week. There'll be several more meetings within 60 days or by 60 days. They're going to come back with a report to us. The report's going to go to the public for input and conversation. And then 30 days later, we'll be issuing a report to the community. I stood here and declared racism to be a public health crisis 2 weeks ago. And now, due to yesterday's budget, we're making investments of $3 million to fund public health strategies and tackle structural inequities. We are moving 20% of the Boston Police Department's overtime budget into physical and mental health programming, the safety and well-being of our young people, and the long-term success of our neighborhoods. I want to thank the city councilors yesterday that voted for the budget, allowing those investments to move forward and advance the work of racial justice in our city. As I've said, systemic change doesn't come from one policy or budget investment. We've seen that doesn't work because it's been going on for decades, not only here in this city, in the Commonwealth, but the country. Our goals must be to build a process for change into the way government and our society works. Today, I announced the next steps that's going to help us do that. I'm taking executive action to create in the first time of Boston's history, an equity and inclusion cabinet in my administration. The Equity and Inclusion Cabinet will drive the work to dismantle systemic racism, embedded equity in all planning and operations moving forward. That work will also talk about taking down barriers to equity and health and economic well-being, accelerating our progress on our city workforce at all levels that reflect our city, and supporting full inclusion and opportunity for immigrants, refugees, and other vulnerable communities. The Cabinet will bring together in existing departments, including our Office of Resilience and Racial Equity, Diversity, Language and Communication Access, Women's Advancement, Immigrant Advancement, and Human Rights. And it will apply an equity lens to every single department and service, ensuring accountability to this lens in all of our city policies and practices. It will put an intentional focus on supporting communities of color and marginalized groups. And it will partner with residents, community groups and organizations, nonprofits, and businesses to build equity throughout our economy and our society. I will be appointing a Chief of Equity and Inclusion to lead this work. The Cabinet Chief will be at the table as we frame and decide policy at the highest levels. And the work of this Cabinet will combat systemic racism in every single way that city government touches and the people and the lives that we touch. An important part of this Cabinet work will be to leverage private and nonprofit resources through cross-sector partnerships. In recent weeks, I've heard from many business leaders who want to put capital behind the work being done by lifting up the communities of color. To that end, I will also today announce that we are creating a new financial resource called the Boston Racial Equity Fund, which will work directly with the Equity and Inclusion Cabinet and the Cabinet Chief. This fund will invest in nonprofits that empower Black and brown residents in economic development, in public health, in youth employment, in education, in the arts, and other areas. Its mission is to increase safety and well-being and equity and the prosperity of the Black and brown community. Our initial goal to raise for this fund is $10 million, and our long-term goal is to get $50 million into this fund. Next week, I will announce the steering committee that will be made up of leaders in business, higher education, and community development. As I said, there is great interest in this work right now, and one of our goals is to coordinate and amplify this interest. In particular, there's a statewide effort being led by the Black and brown business leaders that I'm going to support as well. So we're working with those leaders to coordinate the work that we're all doing, because it's important that it's not just one fund or one group of people. It's making sure that many groups of people, several groups of people, come to the table to continue this work. Together, we are going to capitalize on this opportunity to not only meet the pressing needs, but we're going to empower communities and individuals to define and lead systemic change themselves. This cannot be led by a mayor. This cannot be led by political leaders and city councilors. This needs to be led by the community. This change needs to come through all of us. We have a living model of success that we use for the approach. And the model is the Boston Resiliency Fund, the COVID-19 Health and Equities Task Force. In a very short period of time, we've been able to leverage philanthropic giving into equity gains for communities of color, led by communities of color, around healthcare, around financial relief and employment. And that work gives us the confidence that the Racial Equity Fund can be a game changer. I also have a third announcement that advances equity in housing. This year we'll be filing a new zoning amendment aimed at ensuring access to fair housing in every single neighborhood in our city. This amendment will require developers in our city to do more to fight displacement and to promote inclusion. The BPDA is working with the Department of Neighborhood Development the Boston Housing Authority, the Office of Fair Housing, to create a project assessment tool. The purpose will be to identify and address the risk of displacement, as well as foster access for historically excluded communities. I want to give a big thank you to City Councilor Lydia Edwards for her leadership on this issue. We had a meeting a couple weeks ago, and Lydia made it real in that meeting about the importance of this amendment, about saving people's ability to live in their communities. I also want to thank City Councilor Kenzie Block. They have worked very closely on drafting this language, and we look forward to additional conversations with the council as a whole and the community. Thanks in part to this collaboration, we believe Boston will be the first city in the country with fair housing requirements written into our zoning code. This is not a new idea. This came under President Clinton, was changed under President Bush, came under President Obama, was basically eliminated under President Trump. And this will be the first time that we put this in a zoning code in a city where, regardless of who's sitting in Washington, D.C., those protections are still there. The steps that we launched today are further steps towards systemic change. An Equity Inclusion Cabinet restructures the executive branch of city government here in City Hall to put racial justice at the center of decision-making process and implementation process. A racial equity fund draws on the wealth generated in Boston's economy, much of it through the work of the black and brown residents, and directed back into the communities of color. A fair housing amendment in the zoning places real racial equity mechanism into development. We all know there's still much more work to be done, but we have made a strong start, and we are well positioned to continue this work. These structural reforms strengthen our ability to drive systemic change through our city budget. That's what the City Council approved yesterday. We refiled the budget after taking into account the economic impacts of COVID-19 and the battles that lies ahead of us with this pandemic. We started this budget with the resubmission with $65 million fewer dollars than anticipated. We refiled it after we listened to and responding to the mass movements for racial justice on our streets. We refiled it after an extensive review with the City Council. The budget embodies those realities and strikes the best possible path forward. We also are looking at historic advances in equity, something that we considered throughout this budget process. More importantly, in the last several weeks. We're making an $80 million investment, or 7% increase for our schools. There was a story yesterday in the Boston Globe. Our budget story is on there, but there's a story, I'm not sure it was above us or below us, talking about how districts in the Commonwealth of Massachusetts have to lay teachers off because of the crisis they're facing. We're making an $80 million investment in our schools. $16 million increase to affordable housing, including one of the first city-funded rental voucher programs in the country for families that are underhoused and making sure that are in shelter. In addition, a $13 million increase in the public health budget, $3 million from the police budget to directly address racism. This budget confronts the challenges and embraces the opportunities of our time. So, as I said, I'm going to end here. As I said, this is only a beginning. It's a strong start, and we are certainly not going to let up here in the city of Boston. With that, I'll open for questions.
Mayor, the equity inclusion cabinet, is this something that procurement budgets, which requests like that from other departments, will approve them? Will they provide guidelines for what they expect those departments to do? How do you envision this?
They're going to, well, the question is procurements and city contracts and other things. Will they be running through this new cabinet, the Equity Inclusion Cabinet? What it's going to be doing, the Equity Inclusion Cabinet will be working cross lines, cross departments, to make sure that when we set out goals, that those goals are hit. But also within the jurisdiction of them, they have 5 departments: women's advancement, immigrant advancement, some of these other departments. So really, as we think, the way I'm viewing this is that every conversation that we have at the cabinet, we talk about equity and inclusion now at the cabinet, and we talk about it in the sense of when we talk about different issues, whether it's procurement, whether it's policing, whether it's fire, whatever it might be. But this is something he's going to be talking about every single week when we have a meeting.
Well, let's just there, these police budget and say, we'd like to see this kind of spending on this kind of program in the police department.
Yeah, that's what the intention would be for this cabinet, to really think outside the box and to come to me with new ideas on not necessarily policing, but how would we look at doing different revenue functions, maybe having conversations with the police department. What are some of the things that have come that they would like to look at? So, for example, one of the conversations that's been happening in the last 4 weeks is that the police get called right now to almost everything that happens. You call 911, the police show up. Some of that is mental health issues. Some of that is substance use disorder issues. There are we're looking at some models around the country of cities that have a different approach to that. So rather than send a police officer to a call that might have somebody that has mental health issues, we think of something different. So that person will be working across pattern there, working with public health, working with economic development, working with all of our cabinets. That's the intention behind this. And to make sure that our work, I mean, we want to make sure also, so when somebody comes up with a policy, whether, let's assuming it's neighborhood services, the neighborhood services cabinet, we're looking at through an equity lens as well. How are we making sure we're hitting the right populations, doing the right work? And we're gonna put more about that next week as well. Yeah. Well?
We just went through, the city council went through a really tough budget negotiation. Most of the councils of color voted down the budget. The divisive issue was that 10%, the demand for a 10% cut in the police budget.
Yep.
You came to 1%. It seemed also polling shows that the majority of people want to see policing done differently. How do you respond to that discrepancy?
I wouldn't necessarily call it a discrepancy. I think that what I would say is that we have a budget process here in the city of Boston. We had to have a budget passed so we can get July 1st the budget moving forward. I made a cut of 20% out of the police budget for the overtime. The first ask was overtime. We reallocated that money into programs that are really important. We put together a review committee now to look at policing, and I think the conversations off the last question I was just asked, we're going to be looking at what are other opportunities for us to reduce some policing in the city of Boston. Do police need to go to all these calls? We're going to be working as we move forward here. You know, I think yesterday's budget had serious consequences if they weren't passed. It wasn't passed. The conversations that we had were real. We have a $65 million shortfall in our budget due to COVID-19 and the economy. We're probably, depending on how our economy moves forward, might have to make additional cuts later on down the line if our economy doesn't turn around. All indication shows that we're potentially headed for a national recession, again, if we don't get our economy turned around fairly quickly. Not caused by anybody, it's caused by COVID-19. And to make cuts like that, you can't just say, it's not just simply making a cut in the budget, it's about making sure there's a plan on how do you move forward. And I think that that's what we're going to do here in the city of Boston. If the budget didn't pass yesterday, there was going to be a notification sent out today to the unions to anticipate layoffs coming, because we just simply have less money. And I think that yesterday's budget, in my opinion, was a great budget in the sense of what we're dealing with today. Quite honestly, I would argue my last 7 budgets have been great budgets because we've been focused through the lens of equity in all of our budgets, whether it's additional money into housing, whether it's additional money into trauma, whether it's additional money into recovery services, additional money into homelessness, all of the different places. So I think what we need to do now is move forward and take the next steps moving forward, and how do we collectively work together. We need to work together. We can't work individually. And I think that's the next step we have to do.
Elaborate on sort of where the city's at and thinking about, as you just talked about earlier, maybe sending people who aren't police to different emergency response.
No, you can't. The question is, can I elaborate a little bit on sending people who are not police to emergency calls? Again, we have to, Sean, we have to really think about what these other cities look like and how the program works. So we have some work to do. You can't just make a quick switch like that. And again, work with the different communities. I think that we have to spend some time sitting down with our police department, the leadership of the police department, to talk about some of what they're seeing and what they might understand, realizing that it's probably more appropriate to have a mental health professional working with some of the cases they get called to. So we're going to have those conversations as we move forward here. I think that's one aspect. I also think the other aspect is just making sure we continue. The police in our city are still doing their job every day. They're getting up and doing their job. They're doing some incredible work. We've seen some really incredible arrests over the last couple of days with gun activity and what we've seen there. We've also seen our community service officers out with the community as best they can be with COVID-19, but they're out there working in the communities, continuing to build that trust and relationship. And I think that, at some point here, we need to start taking steps forward and to continue to move forward in a positive manner. I think that that's hopefully what we can do now. I'm certainly not going to, and I said this from the very beginning, with the murder of George Floyd, things felt and feel differently in the city of Boston, at least in my gut. And the announcements I'm making today are not the first and not the last on responding to what people are asking for, whether it's the demonstrations that we've seen, whether it's the protests we've seen, whether it's the letters we've seen, or the phone calls I've had with people. I've talked to a lot of people over the last 4 weeks, and I think that at the end of the day, some people wanted more money, $10 million more cut out of the police budget, but really what people hopefully at the end of the day want is real movement. And that's what that's why I promised, and that's what I'm going to do. And that real movement, I would love that real movement to come with the entire city council next to me, so we're working together on a truly equitable city here in Boston.
Part question. There's been some criticism online of the city for allowing some of these protests and demonstrations, all of them, over the last couple of months, while keeping restaurants and businesses closed, telling people to social distance and wear their masks. So wondering the reaction to that.
That's a question that can be asked to every mayor in the country, and quite honestly, the protests are a movement. It's not a protest; it's a movement. People want something different. They want the issues of racism and systemic racism addressed in all matters, not just in policing. And I think that that's something that, as we move to the next steps, we're going to talk about economic development opportunities. We're going to talk about health disparities, which we did last week. So again, listen, some people want me to shut down the protests because they don't want the protesters in the city of Boston. So quite honestly, I'm asking the protesters, when you come out, be respectful, respect the city. COVID-19, I'm asking protesters, actually I didn't say this, I should have. When you're out protesting or marching, do yourself a favor, wear a mask. Try and keep social distancing. COVID-19, you're not immune to it. You're seeing spikes around the country. If you get the virus while you're out marching the streets, and you have an elderly parent or an elderly grandparent living in your house, and you go home at night to talk about what you did that day, if you have COVID-19, you can pass it on to them. So we're asking people to be careful. So the restaurants were closed and the business were closed for a reason. They should know by now. If people don't understand on the restaurant side why we closed them, then people just aren't paying attention.
Permits, or have they issued any permits for any of these protests? What's the policy on them?
No, not to my knowledge. The policy generally is you under circumstances of having rallies, you would apply for a permit. I'm asking now for the protesters, if you're going to be gathering in large spaces, would ask you to apply for a permit.
It's going on right now for 3 days. Typically, since we have come really fast, hearing about is that something you're according to with the spoken about that?
I think that's something that I wouldn't have a hearing. That'd be the city council, I suppose. I think that if we change the name of Faneuil Hall 30 years from now, we'd forget what happened there. And I think there are certain parts of our history that we should use and learn from. And so I'm not in support of changing the name of Faneuil Hall.
You mentioned parts of the country are seeing spikes. We're hearing today new guidelines for the schools in the fall. DU, one of several colleges that break into. How concerned are you about a serious spike in the city? And would you like to see the governor say what they've done in Connecticut, New Jersey, and New York, certain parts of the country, quarantine 14 days?
Well, I think we've done that here in Massachusetts. we just had a meeting today about City Hall and reopening City Hall a little more than it is right now. And our regulations and guidelines are pretty strict, which means that if you're a city employee and you take a vacation, I don't know if we put it out to people yet. We're going to put out. If you take a vacation, you leave the Commonwealth. When you come back, you have to quarantine 14 days. So I think that we already have that in place here. I think it's really important for us to continue to watch the data really closely. We still, every day here, are talking about COVID-19, and we're still focused on the data and the trends, and we're watching that closely. And, you know, I'm hoping if we see a spike, we'll be able to catch that. So, for example, when I mentioned, I think today was 26 cases, the last 10 days, the highest case in the last 10 days was 33 cases, and I believe it was 4 or 5 days ago. So we're watching that really closely. Marty Martinez, who's around me here somewhere, we're in constant communication about this. Questions you just asked me, I ask him all the time. What do you think? I don't know. You want to address a little bit of that? Just to say a couple words? Hear a different voice?
Yeah, I mean, I think there's no question that we're monitoring cases, we're monitoring positivity rate, we're monitoring hospitalization, and we're not seeing what they're seeing in other places. But are we concerned? Are we monitoring? Do we want the state to also do the same? There's no question, because the reason you're seeing what you're seeing in other places is that they have loosened, and some might argue they've loosened too quickly. And so we're not doing that here in Boston, and the mayor's been really particular that we make sure we follow guidance. Even the school guidance that's come out, we want to look at it and make sure that we're doing it what's best for Boston. So that's a really important piece that we're going to not lose focus on.
College kids coming back from Florida, Arizona, Texas.
Yeah.
That could be a slight wait for that.
Yeah, to your point about college students coming from all over, we've been working with our colleges and universities, and as you know, they're sort of independent entities that are trying to work with the state and the city, but we've been clear that we have to follow the data and the science. The mayor's led with that the entire way, and if we start to see these increases, we'll have to make sure that those plans account for that, so that's really important.
Before I end, I just want to say one last thing. And I was just thinking as Marty was talking, for the last 4 months here in Boston and Massachusetts and around the country, there's been a lot of stress around COVID-19, a lot of concerns people have had about their health and about their family's health. And as I said consistently through this microphone, that we will get through it one day at a time. And I've been clear on that. 4 weeks ago, after the murder of George Floyd, it sparked a lot of emotion in this country. That emotion runs the gamut. For me personally, very been emotional time. And I just want to say to everyone, as long as we continue to stick at it, as long as we continue to be very, very supportive, vigilant on all that we do, we will get through this time as well. And at the end of the day, our goal is to get through this as a better city. A better city, whether it's around health disparities, whether it's around housing disparities, whether it's around economic disparities, disparities in public safety, whatever it might be, we're going to continue to get forward. So I just ask the people that are out there that feel the pressure of what we're going through today, because a lot of times people won't talk about it. We will get through all of this one day at a time. We just need to continue to support each other, work together as a city. Boston has done that time and time and time again. And I don't think I have to ask the residents of Boston. I think we all know it. It's embedded in our heart. So as we continue to move forward here, we will get through this, and we will be even a stronger Boston. Thank you. No, I don't have. No, was it American Legion Highway? No, I don't think it wasn't. I don't think it was. I'll get the information. I don't know that. I wasn't. All right. Thanks, everybody.